I am Dr. Thushan Beneregama, consultant plastic surgeon. So you must be a lady who is having a large belly, for maybe following a childbirth or maybe very young age. Is there a solution for this? Is it a liposuction or a tummy tuck, or is it a non-surgical procedure? The answer to that question has to be following a proper clinical assessment. So if you are having maybe 1 or 2 kids or maybe 3, so what happens during pregnancy, the muscles in the abdomen, the tummy, they separate, and that will never go back to the original position. So with every pregnancy, they stretch more and the muscles will become weaker and weaker. So it has to be, if you want to flatter tummy, it has to be surgically corrected and surgically tightened. And the liposuction alone will not give you a proper flat tummy. But if you are having too much fat on the either side of that tummy, so that can be addressed with liposuction. So with abdominoplasty, or we call tummy tuck, so we do liposuction on the sides as well, if the patient has too much fat on the waist or the either side of the tummy. But if you are a young person and who is very fit and athletic, and sometimes the lower part of the tummy is maybe bothering you, or maybe the waist, and those people, we have to first examine and see the amount of fat you have, whether the surgical procedure or there are non-surgical procedures to dissolve the amount of fat you have, and then only we can decide which treatment modality suits you best. So therefore the clinical assessment is very important, depending on your age and whether you are having kids. Then only we can decide whether to do a surgical or a non-surgical procedure, and sometimes combine these two procedures together depending on the individual.